Welcome to Relax with Yogi Bryan. I have Dr. Stephen Sorr here, owner and medical director at Source of Health. How's it going?
Thank you so much for having me, Brian. Everything's doing good. Just enjoying our staycation. How are you doing?
Yes. Oh yeah, I'm doing good. Enjoying the staycation, enjoying taking a lot of yoga classes from some of my favorite yoga teachers. And I saw on YouTube you have a yoga class that you posted. I'm gonna have to do it. So
I
yeah.
do. I do. I think it's such a great offering for everyone who is at home, and the world is really coming to try to join hands together and help each other out, and that's really what we need right now.
Yes, yes. It's exactly what everybody needs. Community, get together, help each other out, that energy exchange. And I was reading a little bit of your bio, and I met Dr. Sorr in my yoga teacher training. He was teaching the anatomy. And when I first was going to do anatomy, or when I first saw the class, I'm like, oh my gosh, like I'm not a science person. Like this is going to be super boring. Like I'm not going to get it. And you had the most amazing videos, and you broke it down to me that it was just so easy to really see and learn the anatomy. So thank you so much for that. But when I was reading your bio, you healed a back injury at 18. How did you do that?
Yeah, so first of all, it's very difficult to heal the back injury. And one of the things, it's been 20 years. I mean, I can't believe that time has flown by that fast. We don't even know what day we're in today. Like
Gosh,
apparently
right?
it's a Sunday or something like that at the time of the recording. But when I was 18, I didn't know what was up or down. I mean, you're 18 years old, and this injury, it took me down. It completely altered my
Yeah.
trajectory in life. You don't see these things coming. And, who's to say that my two discs in my low back were herniated at that moment? But that's when it started. I mean, I just stood up from doing homework in ASU, just second semester at college. I stood up and it went right down my leg, and I like barely,
Oh my
I mean, I fell to
gosh.
the floor. I was like, what? I was all by myself just doing my homework.
Yeah. Homework injury. You
A
don't hear
homework
that too
injury.
much.
It's bad for your health, And then I continued to press on and eventually became a physician. So a lot of incredible life experiences, meeting a lot of people along that journey, and all of these experiences bring us to this moment. So thank you for having me on here, and I'm happy to share any of my thoughts or any skill set that I can offer to you and your listeners.
Amazing. And you're actually my first guest I wanted to have on this podcast. It's a new podcast, new project for me, just because me personally, I came to meditation to relax and just kind of deal with trauma and just breathe.
Sure.
And I know a lot of people out there, like especially in times like this, need to like relax or need breathing practices in yoga.
Yeah.
Hmm.
Yeah, a lot of people enter into a yoga practice because of some sort of pain, and pain is an incredible teacher. Some are just like, hey, I want to try a new workout class, and I heard this is pretty good, it helped calming me down. So when people are not in pain, it's hard to relate to that, but pain can be from many different origins. There's psychic pain, trauma, PTSD, emotional things like anxiety and
Hmm.
depression, and then physical pain. There can be a lot of problems with people's digestive system, which cause a lot of psychiatric conditions and physical conditions too, manifestations like inflammation. So, we're able to create a language and a vocabulary, create a safe space within a yoga practice to start to create this insightful practice inward on that own person. And that journey is incredible. When I started with yoga, I'm definitely a nerd. I mean, I admit 100% I'm a nerd, but the way in which people like you share is the way that I tell that story, the way that I explain the anatomy and make it relatable, that you don't need somebody who's monotone up there, just like speaking right out of a textbook. It needs to be relatable. So it's all in that telling of the story that has really attributed a lot of the success. And I hopefully have kind of pervaded what I say into the yoga community here in Arizona, as well as anywhere else that people have taken my class or subsidiaries of that. It just ripples out.
Yeah, it ripples out, and just that knowledge you share and just the alignment. When I first heard about you, I heard you're like Iyengar based, and you're like, it
Yeah.
took like an hour to get through like sun A's or sun salutations, because you're just so like alignment based. Are you Iyengar based? Like, was that where you learned
So
yoga,
I
or?
initially started teacher training with a teacher who was Iyengar and Anusara certified. So when I was in my process, I was learning everything in a bit of a school setting, very, very strict and rigid,
I see.
learning philosophy in a separate class, if you will, and then doing the practice and then doing asana workshops and breaking down. But looking at it from those anatomical perspectives, I
Mm.
really like Anusara as well as
Okay.
Iyengar. I think they merge together. So the loops and the spirals in
Mm.
Anusara's verbiage are helpful because, again, that's a visual, that how things are, looping through or spiraling up. You can see that, and you can move your body within that, in that shape, that geometric pattern. So that helps people. You don't need to know bicep, triceps, sartorius, gastroc. You don't need to know the names of the muscles in order to contract them.
Right.
It's just cueing people to so that way that they can figure out what it is that we're looking for.
Yes.
Where are we directing the mind as we're in a certain posture or the movement or transition between them?
Definitely. Definitely. So it's not really overthinking, like just the anatomy. It's really just cueing them into that position, and
Yeah.
making it simple. Now, with your back injury when you're 18,
Mhm.
did yoga help it, or how did you
Oh,
like
very much so.
naturally?
So I originally went to a neurosurgeon and he didn't want to cut me because I was 18. And so I did physical therapy and I took a lot of drugs. My father's a pharmacist, so
Mm.
that's what we just know like the back of our hands. And I did that and it wasn't great. I mean, I was in a pretty bad place. I was extremely depressed.
Mm.
I like lost so much weight. I was so skinny and I just couldn't move. I mean, it was really, really hard to just like be limping all around. I couldn't sit in a chair. Uh, life was different. But when I had decided to go back to school, I decided to be a chef. I thought that creating food would be great. I had no perception that, oh, you're going to be standing on your feet, lifting heavy things.
Oh
And
yeah.
that part didn't even occur to me. I mean, I was still in that comatose, but I did it. And my parents wanted to support me with whatever decision I had. So I went with that, and I met some really good friends that I'm still friends with today. And I just ended up at a gym, a very meathead kind of gym. And I walked in there, and I'm doing my little physical therapy things, like draw your knee to your chest, doing like little prone press ups, we know as Cobra, doing those. And it was an incredible thing. This girl just like says, "Hey, come on over here." I'm like, "Oh, no, 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 no. I can't do yoga. I don't even know what that is." I'm in back pain. So she
Yeah.
brought me a folding chair. She had me like
Oh
stand on
wow.
the chair and she's like, "Here, that's your block." And that's how I
Nice.
started. That was my first yoga class.
Wow.
Yeah. So
Amazing how yoga finds you sometimes, or amazing how the
it's
solution finds you.
it's incredible. And I think that for a lot of people that are new and or haven't done yoga, they're extremely apprehensive. They're nervous, they're scared. The number one reason why people say they can't do yoga, I mean, everyone
Right.
knows it. I'm not flexible.
Yeah,
I
exactly.
can't do yoga. I'm not flexible. Like, what? But that's what's in the mind as far as the excuse or the reason to
Hmm.
stay in that moment of suffering or that state of injury. Are you not miserable enough yet? I mean, do we
Yeah,
need
right.
to? How much more miserable do you need to be before you enact some sort of change?
Yeah, and enact some change. And so you went to school to be a chef, and what changed? Now you're a doctor. Like, what
Yeah,
changed?
yoga
Yeah.
changed. Yeah, so I was in culinary school and I became a chef, and it just it got to me at some point, and I was still practicing yoga, and I started then getting into teaching yoga, right? And throughout all that time, I stopped eating red meat because it just didn't sit well in my philosophy. Not that I was gonna, protect the cows and like chain myself to a tree and all of that, but it just didn't reside with me because of the philosophy in yoga and eating foods that are lighter. I didn't know about medicine at that point. I just knew about the philosophies of being more sattvic and light.
Mm.
So, eating better and having the culinary background, I could make anything. I can do anything in the kitchen. And then I started having some cognitive dissonance where I couldn't keep doing what I had been doing. I just broke down one day. I was like, I can't do this anymore. And I was teaching yoga, and somebody had mentioned naturopathic medicine to me, and it all clicked. It just all clicked. And the little slogan that got me was mind of a doctor and heart of a healer.
Oh,
You got me there.
yep.
There, I don't even know what naturopathic medicine is. I'm signing up for this. I'm gonna go back to ASU. I got all my science prerequisites and everything was done. I was just like on that track. And I said before, I'm a nerd, right? And I've always been into science, so I only had to do science classes. Like I already had all my business stuff and all my prerequisites, like for my associates and English and math and all that was taken care of. So all I had to do was take science classes. Brian, I was in heaven. I got to take biochemistry, endocrinology, cell biology, and all of this stuff
That's so cool.
in one semester. And it was joy to me. I loved it. And then most people were like,
Just
oh
soaking it
my
all
God.
up, right? Just soaking it
Yeah.
all up. Yeah.
The advisor's like, oh, you just need an elective. Why don't you take like art history online? I'm like, thanks so much. I'm going to take endocrinology because I'd like to take that. And
Yeah.
I still use some of that information. It's still inside my little file vault up there.
That's awesome. That's amazing.
Yeah.
That's amazing
I got some
because
med
you're really
school.
like naturopathic medicine, like you're really helping people. And like personally, I've like struggled with like mental health stuff and like anxiety, stress, and
Sure.
like I've probably taken all the medicines possible. And I didn't start feeling better until like I started doing the natural ways, yoga, meditation, checking my hormone levels, like are all those well, eating properly. Because I feel like, and just my experience, like doctors just wanted to throw pills at me, throw medicine at me,
Yeah.
and that just wasn't really helping for me. So
So it's a model. It's a model of healthcare where, and it unfortunately for most people, it doesn't work for the issues that you have. But when you go to a regular doctor who prescribes drugs, they don't really have the training that we
Mhm,
do. So I could prescribe the drug. I have training in it. I don't
mhm.
want to put somebody on antidepressant if they're deficient in something.
Yeah,
I don't know. I don't want to give medical advice, but maybe they have a fish oil,
yeah,
a fatty acid deficiency. Maybe their hormones are off, and figuring out those causes. Like, are you depressed because you're not sleeping, or are you not sleeping because you're depressed?
yeah,
I mean, chicken or the egg here.
exactly.
And when we take a zoom out approach and we look at what are the foundations of health, let's focus here. This is like our
Hmm.
base of the pyramid. Work on your foundation. And
Yes.
that may be able to then treat some of these other symptoms, or they just whittle their way out. You don't have to necessarily aim up at a symptom here and there. I mean,
Hmm.
I've gotten people off of blood pressure medicines, off of their antidepressants, because they've changed what their whole nature, the fabric of their own body is different. Their terrain has modified to where they don't need those things anymore.
Yes.
I never take anybody off cold turkey. I mean,
Mm,
that's inappropriate, but
right.
it's really about a different approach. And this is called patient-centered healthcare.
I love that.
So if it's called patient-centered healthcare and I have to say patient-centered healthcare, then what's the alternative? What are people normally doing? It's doctor-centered. It's actually insurance-centered, to be really,
Mm,
really fair to all of the doctors that are working really hard, seeing like 50, 60 patients a day. You can't connect with your doctor in 5 to 10 minutes. It doesn't work. They
gosh,
don't,
yeah.
they're moving so fast and they're clicking away at the computer. It's hard to make contact. So I never see more than 10 patients a day. I just won't do it.
Oh, wow.
And because I spend about half an hour to an hour with patients, and they need that care. They need that talk. We have to work through. So tell me a story or tell me an example of how you feel. So we're doing some of this mind-body counseling just within the nature of spending time. And you get to ask the doctor, and that goes through my soundboard. And we filter out and come up with a treatment plan that's based on you and the evidence. So the evidence has to be something that can then match up with you. And that's how we
Yes.
move forward in healthcare. And the nice thing about, just even being on the Zoom call is we can do telemedicine. So as long as I'm not doing a procedure on you or needing to listen to your heart, which there's technology for that now too,
Oh,
but
wow.
taking your blood pressure, you can do a cuff at home, you can do a pulse ox at home. So for the cardiovascular system, you can do things like that. But as long as you don't have an orthopedic condition where I need to actually physically examine
Mm,
you or, you know, do something physically, we can do a lot of things from this perspective once you're an established patient.
technology is amazing. Technology
Absolutely.
is amazing.
We can order labs. You go to get your blood drawn at a draw station. We go over the results and we just move forward. So I see a lot of patients remotely, even more so now because of the current situation. But I love being able to be responsive and help people in a profound way. And, you know, I am not going to be everyone's cup of tea. I am very, very serious, and I don't take the crap from people saying, oh, I can't do this and I can't do that. You can, you just don't have the proper motivation and why. So let's get to that. I don't treat victims. I can't handle the whole
Mm,
victim mentality. It doesn't work. I like warriors that are proactive and are saying, I see that my blood, that number, let's say it's my testosterone is not there. What are the steps that I can do to get that up on my own? And if
yep.
that doesn't work, I will yield. I say, you know what? We tried exhausting our efforts
Hmm.
to raise it on its own. It's not going to happen. Let's just bring you back up. And that's fine. But work with your body. Give your body a
Yes.
chance. Don't take this quick fix, easy way out. There is no easy way out. There's always a cost with the easy way. But
It's so true.
the way that's wholehearted, the way that is holistic, if you will, is by doing the work that you need to do. And nothing fixes sitting, like standing up and moving around.
Right? Yeah, exactly. Got to do the work. Got to move. Got to move.
Absolutely.
I've heard like some of the best exercise is just walking. It's just like taking a walk. Like that's what I've heard. I've been like throwing that in my
A walk
routine.
is very good for multiple reasons. So mechanical receptors, by just stimulating your mechanical receptors, walking, override the pain receptor.
Uh,
So walking is also stimulating your brain. You walk with opposite arm and opposite leg. So you're getting both sides of your brain working
Interesting.
so you don't get stuck. Imagine two boys fighting in physical ed, and the coach says, go walk it off. There you go.
Right?
So
Yeah.
walking is good for the brain. The body, it's not a huge effort on the body to go for a walk because it's not like a physically intense kind of procedure. You're just moving.
Yeah, just moving.
And motion is lotion. Movement helps to
Motion
lubricate the
is lotion. I
mind,
like that.
and it lets your brain clear out things that are stuck.
Ah,
It's
love it.
meditation in motion, right?
Yeah,
Just like
meditation and
flow.
motion, walking meditation, just flow.
Yeah,
Like I've been doing. Well, I got a puppy now. He's 11 months old, and like
that's
he's
good
been
though.
causing me to go walk. So I walk in the
Yeah,
morning. I walk, and I feel good, and I get so many ideas, so many meme ideas, or like just things that I need to do. I'm like, oh yeah,
yeah.
awesome,
You
just
are the
feeling
meme
good.
master, aren't you? Yeah.
Thanks, thank you. And you know what? One thing that I just really loved about you, or I love about you still, is just your honesty, and like I feel like that trust. I've been taking like isogenics like since Rebecca recommended it to me, and I only did it because she said you did it and you recommend it. So like I take it every morning, and
Mm.
it's just like been really good. It's like my morning breakfast. So appreciate that and appreciate your honesty.
Oh, absolutely. Yeah. There's a ton of options out there. And sometimes something that's like already done for you, a simple system, is a good way to go. We have medical systems, we have basic systems. I just get very nervous when people start buying stuff online just because
Mm,
it's on like Amazon or whatever crazy website that has like a huge dispensary full of things. You don't know what you're messing with. Food is medicine, but food is also not going to hurt you with a bite unless you have a severe allergy to it, right? But you know, I do really practice the principles that I have been learning for over 2 decades with yoga. And yoga's medicine system is called Ayurveda. And I taught the Ayurvedic
yep.
portion within teacher training as well. The way in which we heal our body is by understanding how foods affect us. And with Ayurveda, the principle, like loops and spirals with Sorr Yoga, the principles in Ayurveda are with the different tastes. So you have the different taste.
Mm.
So something that's sweet does something to your body. Something that is sour, salty, bitter, pungent, astringent, those different tastes have different effects on your body. And I could then correlate that back into what molecule is doing this and that. But again, that's only for my brain. For
Yeah,
me to know, and you never need to find out.
yeah. Just cue those videos. Those videos were really just useful in
Oh,
just
awesome.
seeing it and not making it super complicated. Like I could follow those videos that you did. Are you teaching any yoga teacher trainings right now, or?
I'm not doing any teacher trainings at the moment. I have my Sunday class when the health clubs are back open again. I do teach a Sunday class, but until that lift is over,
Right.
we're
Yeah.
just doing it from home. No, but yeah, I'm open to always teaching. I teach over at ASU. I have a nutrition class that I jump in and guest teacher there at ASU. I also am a preceptor for incoming medical students. So I offer an internship for a semester with, just undergrad students that are pre-med that are looking to go into medical school, and they
Awesome.
want to have some experience with what is life like as a doctor and running around like I do in my office. So even though I only see 10 patients a day, I'm running around and doing a lot of high level activity. So it's good
Awesome.
for a student just to see that and experience it.
Yeah. See the real life scenario for you.
Yeah.
Let's get to relaxation.
Sure.
Parasympathetic nervous system. I talk about it a lot in my yoga classes, and that's
Yeah.
just a big word sometimes for the
Yeah.
average, or just for the average yogi that just comes in. Parasympathetic nervous system. Can you explain kind of like an
Sure.
overview, easy way?
Absolutely. Okay. So first of all, medical words have a lot of syllables, so that makes it a little bit challenging. But our nervous system has different compartments in it. So we have our central nervous system, which is the brain and the spinal cord, and then within that, you have then branching out to the peripheral nervous system. So our brain has different wiring set up. So sympathetic is not like, oh, they're there. Sympathy. It's just so you have some wording issues there because you're going to cross-reference that word. So you have sympathetic and parasympathetic. So sympathetic is the adrenaline system, so fight, flight, freeze. Parasympathetic is rest, digest, and heal. So it's literally yin and yang,
Mm.
right? In yoga, we have the whole system of Kundalini, right? The Ida and Pingala, which are the serpents that go up along the spine. That's your parasympathetic nervous system.
Interesting.
So you can see those two serpents that make the medical staff, the caduceus.
Yeah. Yeah.
That's your parasympathetic nervous system and your sympathetic nervous system. It's all tied into the imagery.
I see.
So the number one parasympathetic nerve that we have in our body is called your vagus nerve. Vagus, the root is vagabond or the wanderer. So when they were discovering the human body and they were naming all of these things, they took the Latin word there. But there is a nerve, a cranial nerve that comes out of your skull and goes down on the carotid artery, comes down to the heart, the lungs, the stomach, the small intestine, and half of your large intestine. Pretty much like your whole entire torso,
right?
this whole thing goes through. And its job is to rest, digest, and heal. So its action is to allow breath to expand and contract. It allows your heart to slow down, blood vessels to relax, sending blood stream to your digestive system, turning on your digestive system through neuroendocrine signals. So the hormones and nervous system impulses, and waking up, turning on your immune system or not as a result of that. So the parasympathetic nervous system is very, very important. You have other parasympathetic nerves that come out of the neck and out of your sacrum, your sacral plexus, and that's an important component when it comes to signaling the body to move into that state that we need it to be in. So a lot of people who are high strung and very tense can have a tendency towards constipation because that sacral plexus is locked up. You can't let it go. So you literally can't let go, and that's constipation. Yeah, so we call those people very anal retentive. They don't have their comfortable spot. So you can see that parasympathetic activity can be beneficial for them, right? Somebody who's stressed out in their mind, all of this tenses up, and then they can't breathe, they have heartburn, so they're holding it up here. So you can almost see somebody and kind of clue in to where that goes. So when we learn people's history, we learn, are they stuck in sympathetic dominance? Most people have sympathetic dominance issues. So by giving you hormones or by giving you something that's going to affect your nervous system, like certain amino acids or peptides, are we doing the best medicine by still giving that to you versus you learning how to do it yourself?
Right.
And it's that teach a man to fish analogy, right? I can give it to you, but it doesn't teach you how to do it on your own. And some people, face it, just use Velcro. They never learn how to tie their shoes. Slip on only. They never want to tie their shoes. Just do it for me, something simple.
Yeah, just an easy way.
Yeah.
Easy way.
Yeah. And we've become very complacent and comfortable in this environment in our society. And guess what? Life is now changing, and you will either adapt or you will die. So it's adapt or die. And I think that it's incredibly important. Stephen Hawking's said intelligence is the ability to adapt to change. So we need to raise our intelligence, which means we need to get quiet and still and let that light spark up again.
Yes, quiet.
Turn
Still,
it
do
all
you have
off.
a meditation practice? Do you
I
practice
do,
meditation, or is it
I
just the
think
yoga?
that there's a couple of different ways of meditation. So focused attention meditation is the number one thing. And most people do this and don't know it. If you zone out playing a little video game on your phone, if you are making your cup of coffee or cup of tea every single morning, that's a meditation. It's a ritual. Routine calms your nervous system. Some people have a hectic and erratic routine, like they're running around here and running around here. I'm like, you need to change your routine. It's not working for
It's
you,
true. Yeah,
clearly.
routine.
Yeah, so routine stimulates your parasympathetic nervous system. And I think that we have herbs, we have supplements, we have all these like things you can take, but I prefer things that you can do because usually they're free.
Right. So like what are some, like, I'd say top three, someone listening right now that's feeling stressed out, anxious, what are their top three things they could do to
Breath.
stimulate the breath?
Number one is breath. Make your exhale longer than your inhale.
Mm.
That's easy. Absolutely free. You could do it with your eyes open or closed. Inhale for 4, hold, and breathe out for 8.
Love that.
That's it. You're already in parasympathetic. Just by thinking about that, you switch your nervous system.
Right. Yeah.
Done. Now, will that stay? The next part is actually training. So I'm a huge proponent of, steaming or sweating and then doing something cold to shock back and forth. It's called contrast hydrotherapy. It's been around for centuries. And you want to there are some people that shouldn't be doing this, but again, I'm not giving medical advice. I'm just offering some ideas here.
Mm-hmm.
But just going back and forth between hot and cold is great because you're turning your sympathetic and parasympathetic on as a result of temperature. Heat and ice are pretty much free.
Right. Yeah.
In
Cold
Arizona,
shower,
luckily, it's still the water still comes out cold. It's not quite summertime yet, so we don't have bath water even when it's cold. So that cold water, just ending your shower on cold, is a very simple thing to do. You're altering and affecting your nervous system. That's really important to do. And then I would say above anything else, as far as things that you're doing or things that you could do to work on it, is make sure that you get sleep.
Yes, sleep.
So if you do not sleep, you do not heal. If you do not sleep, you're in torture mode all the time. And a lot of people don't know how to sleep. I think now that you're all grounded. Nobody's doing, I think people are maybe sleeping better. I think some other people might be more stressed out and worried for obvious reasons, but yeah, very interesting.
Yeah, very interesting. And those are great tips. I use those myself. The breathing, the exhale, longer, that helps so much. And like after like 5-10 minutes, like you're just in a different brain state.
Absolutely.
And the cold, I've been doing cold showers in the morning, and that is like, living in Phoenix, like it's always pretty hot, and then just getting in something cold, it's definitely different.
Our
sleep.
pool's like about 60 degrees right now. So
Right.
just jump in. I mean, you're not in there for a long time, and you're in there and you're like, I don't like this. I don't like this. I don't like this. But when you get out, you're like, I feel so much better.
Yeah, I feel so much better. You're just like refreshed. And
you kind of go into like that post-massage type of, it's a little bliss, you bliss yourself out a little bit.
Yeah, amazing, especially the sleep. And that's what I've noticed. I've been trying to like wake up early and get stuff done and meditate, but then sometimes that cuts my sleep out. So like in terms of sleep, what are some ways that people can just maybe get in better sleep, a sleep routine, or is it cut is how's coffee with sleep? I mean, are you a
So some people can metabolize coffee. They could take a shot of espresso and go to bed. I am not one of them. So I cut all my caffeinated things out before noon. I
oh,
don't
before
need
noon?
caffeine. Yeah, yeah.
Mhm.
Some people can go a little bit longer, but I mean, if you're on caffeine and needing to do caffeine all day long, what is that really telling me? It means you are exhausted already, and
Ah,
you're saying, I
interesting.
don't want to sleep. So again, what does that mean? You're stuck in sympathetic dominance, and you're asking for more sympathetic dominance, because what does caffeine do? It stimulates the release of
Mm-hmm.
adrenaline. It raises your blood sugar. It makes you run away from the lion. So fight, flight, freeze, just like a deer in a headlight. And that can be, there's benefits to that. It does, stimulate your cognitive performance, but not for sleeping. Absolutely not.
Right. Yeah, and why is sleep just so important? I mean, just in a big overview. I know you're really good at
Yeah.
making this simple.
So it's very interesting that we sleep for a third of our lives. I think that's
Gosh.
an important evolutionary
Right.
feature. It's not like an inconvenience for people to sleep. We need to sleep. So the way that our brain works is it pulls things, it's much like a computer, right? We pull information in, it goes into a temporary short-term memory, and then it has to get converted into long-term.
Yep.
Now, not everything, your brain is constantly recording everything, and then it has to edit out the light that's above you, the clothes that you're wearing, the glasses on your face. Everything around you has to get edited out because it's not important. So when you're sleeping, you're actually taking what is important and bringing it into your long-term memory. So that shift over, you have to shut down conscious mind to stop recording new in order to then process there. So you need that break. At that moment, your body actually goes into healing mode. So most of your growth and repair happens in the evening. So I see people that have been to many doctors. They go to a chiropractor and they're getting adjusted over and over and over and over and over again, but they're not holding the adjustment.
Uh,
So my question is, why? Why are you not holding the adjustment? Why are you so unstable? And I do stability work. I do injections, like stem cell injections and platelet injections that build collagen at that area. Let's say it's like a rotator cuff or arthritis in the knee or low back, neck pain, whatever. I can't get you truly better until I get you to sleep. I
Interesting.
can't get you to heal unless your nervous system shifts into that healing mode. I can put all of the tools there, but if you do not have the terrain, if you do not create the situation, that opportune moment, you're spinning your wheels again. And now it's costing you more money and time. Time and money are very important. They're these things that we have that everyone just blows away on things. And time is very precious, especially right now.
Gosh, especially right now. And when I was, looking on your website and just looking at some of the interviews that you've done, it's like stem cells is like a hot topic, like, and I don't
It's a
think
hot
people
topic.
understand really like what stem cells do. I think we just hear it in the news,
Yeah,
oh, stem cells are, this or that. Can you give an overview on stem cells?
sure. So stem cells are, again, a simplistic way of understanding how our body heals and regenerates. So every time you get a paper cut, a stem cell is involved, okay? The word stem cell has, the person who coined the term the stem cell in the sense that we're doing, Dr. Kaplan, he's renamed it because it's a misappropriation of the term stem cell. When we
Hmm.
have, let me just explain what a stem cell is and then
Sure.
what it is that we do that isn't exactly a stem cell. So a stem cell is like in your skin, you have a skin stem cell. And from that, mother cell, daughter cells will arise.
Okay.
Okay, so a skin stem cell doesn't look like a skin cell. Just like a bone marrow stem cell that makes red blood cells doesn't look anything like a red blood cell or a white blood cell or a platelet. It's like a parent cell. Okay. It doesn't have a function aside from making little daughters that specialize into whatever that cell type is. Okay.
Mm-hmm.
What a stem cell is that we do, the name was mesenchymal stem cell. I'm sorry. He changed that name. Okay. I'm sorry. I hate saying it out loud. Medicinal signaling cell. He changed the acronym, medicinal signaling cell.
Makes it easier to, yeah.
So what we know about these cells now is that 95% of them, they go to the area, they're like, there's the signal you need, and then they go away. So it's signal. The cells are already there, and then you need a scaffold for things to grow and crawl up and heal and knit back together. So cell, signal, scaffold. So the signal, a small signal can come from your platelets. The platelets will then create this little clot, a matrix for things to crawl along. And then the cells that are there are the ones that get to work and do what they do. Cell, signal, scaffold. Right? Yeah. So we can apply this technology, this science, wherever it is. And depending upon the person's individual injury, whether it's mild, moderate, or severe, we can then determine, do we need to go up to something like stem cell or not? Most of the time it's a not. So people are like, I want stem cell. I'm like, you don't need stem cells. You don't need that. You don't need it. It's so much money that you don't need to spend. Trust me, I've done this a long time enough to see what works for people and then what doesn't. I never want to overtreat somebody. It just costs too much money. I think there's the time and place for sure.
Mm-hmm. And that's what, when I was, I think it was like the Phoenix or Voyage Phoenix magazine, one of the quotes he said is, you're always doing what's safe and prudent for the patient. That comes first over anything else. And that's just, I respect that.
Thank you. That's the whole thing is the ethics and the morals about what it is that we're doing. Everything we do is to improve the status quo of healthcare. I don't want you to go to a hospital because a hospital's job is one thing only: keep you from dying. I think for the 99% of the rest of your life, you're not dying. You might be uncomfortable. So let's work on finding ways to have a better approach to treating our soul, our family, our life, our own bodies. Let's find a better approach here, because we're honestly just not doing everything as good as we can. It's this perpetuation of the Industrial Revolution, and how much money can you accrue, and all this stuff that's a mess. But we're not living a peaceful life for most of the world, and that creates a lot of turmoil and chaos. So this is that suffering that is so often spoken about. So to your point, we have to be patient-centered.
Yes.
It's about the person in front of us, and my ability to stay connected with that person and get them through that journey that they're coming to see me with is everything.
Love that. Love that. And thank you so much for coming on to the show, being my first guest on this show. And I know the audience out there listening to this, you're getting so much value. Where can people find you?
Sure. So I speak a lot on Instagram. So that's my main channel, Dr. Stephen Sorr. We have a YouTube channel at Source of Health, and my practice is here in Scottsdale, Arizona, right off of the 101 and Shea, essentially.
Excellent. Everybody, you hear that? And we'll link this up in the show notes on yogibryan.com, where you can contact Dr. Stephen Sorr. Appreciate you so much. Thank you so much for coming on the Relax with Yogi Bryan show. You all out there need to relax. So take a breath.